Hi, this is Tiffany Joseph, and this is my practicum experience presentation for HAP 789 pre-capstone with Dr. Iman Ilashkar. For my capstone project, I decided to go with the evidence-based research project option, and my topic will explore patient safety through the lens of medication errors. I started out thinking that I would choose patient safety as my topic, but I realized rather quickly that this is a very broad topic, and therefore I narrowed it down to medication errors. My background in pharmacy has made this a particularly interesting topic for me. Researching through several studies will help me to understand more of the data collection process and ultimately learning how to apply the results. My mentor for this project is a practicing pharmacist with a master's in health informatics. This is helpful since he will understand my background and how I can apply the results. The Joint Commission reviews national patient safety goals every year to ensure that healthcare facilities focus on patient safety. National Patient Safety Goals program is based on their impact, cost, and effectiveness. Of the 2024 National Patient Safety Goals, my presentation/project will focus on goal number 3, improving the safety of using medications. The National Patient Safety Goal incorporates 3 ways to do this: through proper labeling, medication reconciliation, and clinical alarm systems. My capstone proposal will highlight reduction of medication errors through the impact of technology, specifically CPOE, or Computerized Provider Order Entry, and an EMAS, Electronic Medication Alert System. It will also discuss the impact of medication reconciliation, as many errors in medication occur during transition of care. Finally, it will show the impact of developing a culture of patient safety. This normally happens in a top-down process, starting with leadership. The second half of this presentation will focus on my professional career portfolio. Overall, the experience was very reflective. For me personally, with my background as a pharmacist, most of my experience has been in retail and hospital pharmacies over the last decade. Because of this, I never really had the chance to sit down and update my resume since the last time I applied for a position. Personally, I felt I should have been better about updating my resume regularly. Over time, I feel that I have forgotten about projects that I have been a part of or recognitions that I have received. I have learned the importance of recording those acquired skills and awards as soon as it occurs, rather than trying to recall what happened in the past. Through this process, I have learned the importance of having samples of work available. In my previous positions, it was mostly focused on clinical work, where my samples were never requested. I am learning that in health informatics, past work samples and projects for school are essential in describing skills. Throughout the creation of my career portfolio, GMU Career Center has been extremely important. I realized the importance of preparing for interviews. One of the advisors from the Career Center mentioned how ChatGPT can be used to our advantage when prepping for interviews. Adding a job description of the specific position can provide types of questions that are commonly asked during interviews for those roles. Additionally, it wasn't until I met with the advisor that I realized that there are two different resume templates. One that is specific for a private sector position and one that is specific for a federal sector position. The private sector emphasizes conciseness, while the federal sector resume wants to see all of your past experiences. Also, I never realized the importance of having a cover letter. Specifically, some tips and tricks suggested that the first sentence should state the specific position of interest. Also, ending the cover letter with a strong, persuasive message by requesting consideration for an interview can be very impactful. Also, including phone number and contact details at the end re-emphasizes your interest in the position, even though those details were already included on top. Overall, these tips were very valuable in creating my career portfolio. I plan on adding to it, especially with the completion of my capstone project. Another refreshing topic was that alumni have access to the GMU Career Center even after graduating. Therefore, it can be used in the future when searching for jobs.